What is anxiety? Today I'm going to be sharing with you what anxiety is, what it is not, how anxiety impacts our physical, emotional, and mental, and what you can do if you experience anxiety. But first, my name is Dr. Vanessa Milagros, and on this channel, we're all about mental health topics such as anxiety, depression, trauma, and relationships. So if you're into any of that, make sure to hit the subscribe button, like this video, and comment below what you want me to talk about next. Let's get started. Anxiety is a natural response to stress. It's a feeling of fear or apprehension about what may happen in the future. For example, you may feel anxious about starting a family, going to college, taking a test, doing a job interview, or making a really important decision in your life. It is important to note, though, that anxiety is not a bad thing. We make it seem like it is a terrible, terrible thing. And a little bit of anxiety is not inherently bad because it helps us to motivate us and push us to do things that maybe we wouldn't do otherwise. So for instance, if you're on a deadline and you're one of those people who you're not going to get anything done until like 3 hours before or less. If that's you, that stress that comes from a deadline kicks you into full gear. And sometimes, for some people, you do your best work on a deadline. Let's say you're preparing to have and start your family for the first time. Maybe that anxiety is motivating you to go out and buy all the parenting books. Ask the parents that you admire their style, how they do what they do. Maybe you're moving to a different place for the first time. This can motivate you to feel a little bit of fear or stress and get you to maybe practice more responsibility and taking on more things to help you through this next phase of life. So anxiety and stress on a minimal level is not necessarily always a bad thing. Now, when it becomes more frequently, more consistently, and on a higher level, then this can lead to what we call anxiety disorders. And anxiety disorders just involve excessive fear or anxiety that interferes with your overall daily functioning. AKA, it is very difficult for you to function normally, whatever your normal is throughout the day, because of the intense feeling of anxiety and stress. Now, there are different types of anxiety disorders. So it doesn't just encompass all of it when you say that, right? So let's go through some of the common anxiety disorders. The first one being generalized anxiety disorder. And this is excessive worry over a number of things that, again, impacts your overall daily functioning. Imagine someone constantly worried about their job performance, their health, or what others think of them, even when there's no immediate reason to be concerned. Someone with social anxiety might avoid parties, public speaking, or even small group gatherings. Another type is panic disorder, and this is characterized by frequent panic attacks. The panic attacks are sudden and intense episodes of fear that trigger several physical reactions. Someone experiencing panic disorders may feel like they're having a heart attack or losing control during a panic attack. There is nothing you can say, there's nothing you can do that will help them get out of it. They are in it, and it feels life-threatening for a lot of people. So imagine experiencing this frequently, often, and not knowing when it will happen next. Then there are specific phobias. This involves an intense fear of a specific object or situation, such as heights, spiders, flying, needles. This level of anxiety can really be debilitating and does require you to meet with a mental health professional. And then there's OCD, obsessive compulsive disorder. This is where individuals experience unwanted and intrusive thoughts, known as obsessions, and they feel compelled to perform certain behaviors. This is known as compulsions. Now let's talk about the different ways that anxiety can manifest physically, emotionally, and mentally for us. Symptoms of physical anxiety include heart racing, sweating, trembling, shortness of breath, dizziness, stomach issues, just to name a few. Now, mentally, lead to excessive worrying, difficulty concentrating on tasks, and racing thoughts. And the emotional impacts of anxiety may lead you to feel restless, irritable, or overwhelmed. So I want you to imagine somebody who's constantly worried about something that they cannot control, which is the future or the past, feeling restless, unable to focus, and this is taking over their daily overall functioning. Now, what should you do if you know someone or you are that someone who is struggling with anxiety. The first step would be to practice mindfulness. Mindfulness involves staying present and fully engaging with the current moment that you're in. Techniques like deep breathing, meditation, and progressive muscle relaxation can help to calm your mind and your body. For example, taking slow, deep breaths can activate your body's relaxation response, and this can help to reduce some of the anxiety that you experience. Another effective strategy that mental health professionals will use is CBT, cognitive behavioral therapy, to identify and challenge those negative thoughts that contribute to your anxiety. You can work with a therapist that is CBT focused, and they will help you learn healthier coping skills to help you work through anxiety-inducing situations. CBT has been researched to be highly effective in treating anxiety disorders. Next, it's really important to maintain a healthy, active lifestyle overall. Regular exercise, the balanced diet, and getting enough sleep for you and your body, while also avoiding excessive caffeine and alcohol, these can all help to manage your anxiety. Next is speaking to a mental health professional or a medical professional, such as a psychiatrist, who can help assess whether medication management is right for you or not. Thank you so much for watching. If you have any other questions or want me to make a video about something else, make sure to leave it in the comments below.